You just wrapped a successful clinical trial up. The results look great, but no one's actually using your intervention. Sound familiar? Hi again, and welcome back to Implementation Science 101. I'm Ruben Martinez, an implementation scientist and assistant professor at Brown University. In this episode, we're unpacking how implementation science differs from clinical science and why that distinction is important. This is a great teaching tool developed by Dr. Geoff Curran. In implementation science, we're trying to implement a thing. That thing is the innovation we want to put into practice. It could be a pill, a policy, a procedure, a mental health treatment, or something else entirely. Efficacy and effectiveness research are the terms used to describe how we study whether the thing works to improve what it's supposed to improve. So, did that new medication for managing high blood pressure improve blood pressure? Did cognitive behavioral therapy for anxiety reduce anxiety symptoms? On the other hand, implementation research studies how we help people and places do the thing and keep doing it well. For example, what's the most effective way to remind physicians that that new, safer medication for blood pressure management is available? What are the best ways to train mental health clinicians how to do cognitive behavioral therapy for anxiety with quality? It can be helpful to think of clinical and implementation science as partners. Clinical sciences tell us what works, and implementation science helps us figure out how to help those things that work stick around. We'll be digging deeper into this how in our upcoming videos. But now it's time for our fun fact. This is not a new problem. James Lind conducted one of the earliest clinical trials that showed citrus could prevent scurvy in 1747. But the British Navy didn't adopt it as a common practice until 1795. That's an almost 50-year gap. Sometimes it's not the science that lags, it's the systems. That's all for today's episode of Implementation Science 101. Thanks again to our sponsors, the Bridge Program at Brown University and Advance RI CTR. Next time, we'll break down what implementation studies actually look like. Don't forget to like and subscribe if you found this video helpful, and remember, keep bridging the gap.